Good morning, afternoon, or evening, wherever you may be. My name is Ann Brazo, the founder of MPN Advocacy and Education International. As many of you know who join us frequently, we host a lot of webinars over the course of 1 year, and we decided to start a series sharing patient stories, but with themes. And as many of you also know, we host an event annually called Women in MPN, and our conference will be September 26th this year, again in New York City. And today I am bringing Patty and Julia, who will join us later, to share their stories from the women's perspective who have gone through menopause, who have an MPN, who have other issues and had other challenges during this time and prior to this time in their lives. So please welcome Patty, and I'm going to leave and let her share her story, and I'll be back shortly.
Good day, everybody. Hopefully, wherever you are, the weather is nice. Here in Ohio, the weather is a little dreary. But anyway, so the subject today is menopause and PV. So to start out, I wanted to just talk about like some of the funny terms that we use for menopause that I've kind of come up with: the flash mob, night sweats chronicles, estrogen exodus, hormone hoopla, swing mood symphony. I mean, these are all some of the symptoms that you have when you have menopause. But some positive words for menopause are like transformation, resilience, vitality, freedom, empowerment, and balance. So my story kind of goes like this. In 2002, I was diagnosed with stage 1 breast cancer. I went through chemo, radiation, and a lumpectomy. Was doing fine. A year later, I had to have a hysterectomy. So when I went through chemotherapy the first time, I went into instant menopause overnight. So at the age of 44. So I've been menopausal now for a very long time. So I definitely understand the issues related to menopause. And then in 2017, I came back from a 200-mile bike ride, and my yearly routine from my doctor said that I had high platelets. So we retested me, and then they did the test for the JAK2 mutation. So I also have the JAK2 mutation. So my initial diagnosis was essential thrombocytosis. And then in 20, I think it was around 2021, I converted over to PV. They kind of always thought I might have had PV. And my suspicion is that I have had an MPN for a very long time, and I think I may have had it as far back as my teenage years. And I'll get into that in a few minutes as to why I think that. Um, and then what my doctors put me on was hydroxyuroxy. During that time period in 2017, we also did a MRI early for my, to make sure everything was okay with my breast cancer stuff. And we found a little spot. So I went ahead and had a double mastectomy. So I kind of had a double whammy there with the double mastectomy and the MPN diagnosis. But getting back to my teenage years, I was just at a seminar recently where they talked about, having the disease at a much earlier age than it shows up. And I honestly believe in my teen years, my periods were so heavy that sometimes I had to miss school because, I had very heavy bleeding. I have also had 7 pregnancies, and I have 2 children. So I've had 5 miscarriages, which, there's more and more research trying to connect some of the MPNs with, you know, miscarriages and heavy bleeding, etc. But I also had very itchy skin. I can remember in college sometimes getting out of the shower and just wanting to scream because my skin itched so bad. But again, I just kind of blew it off and etc. So fast forward to today, and some of the symptoms of PV and menopause are like night sweats, irritability, sexual dysfunction, insomnia, hot flashes, fatigue, and cognitive issues. So for me personally, it's taken me, a couple of years, and I've been in the cancer world now for 23 years. So, and menopausal for 23 years. So hopefully some of the information I give you today can kind of help you out. It's very difficult to talk about menopause when um, a lot of other people around you when you're young and nobody else is going through menopause. And I think it's really, really important to have a very good relationship with your doctors. I have a great relationship with my oncologist, and I have a great relationship with my MPN specialist and my OBGYN. Um, and I really feel that you really need to have your channels open and really talk about some of this stuff frankly. For the night sweats, I can remember going to bed at night, because again, I did menopause instantaneously, and I would literally wake up and I would be sweating so bad that I almost had to get out of bed and change the sheets. Well, I can't wake up my husband and say, "Hey, honey, you know what? I need to change the sheets because like I've sweated so bad." And that's still today, sometimes I do still get night sweats, but it's gotten a lot better because I think I've learned how to control some of the things, some of the factors before I go to sleep. The irritability, I find, that's a common symptom with PV and menopause, and the irritability can happen, I think, when you are challenged with lack of sleep. And we all know that, your hormones help you with sleeping, your diet, weight gain, sexual dysfunction. And, those are some of the really, really important things to talk about. And, so some of the PV and the menopause symptoms, again, like the sexual dysfunction, I've worked with my OBGYN. They're not going to give me hormone replacement, and nor would I want it at this point in my life, because not only because of the breast cancer issue, but hormone replacement. And again, this is not medical advice. And I would tell anybody, whatever works for me might not work for you. And you have to talk to your physicians because it's really, really important that your physicians know your background. So, getting back to the sexual dysfunction, I also found that not only did I have that, but I also had a lot of UTIs. So, again, I wasn't allowed to go on hormone replacement because, hormone replacement can also cause blood clots and an increased risk of stroke. So if you have an MPN, you could be at risk for one of those also. So what my OBGYN and I worked out was using a local vaginal cream. And I can tell you that that does help somewhat. It's not the same as being on hormone replacement, but it does help. I've had less UTIs being on, a vaginal cream, and it does help. It's not going to help the insomnia. It's not going to help the hot flashes. And definitely you have to figure that out for yourself. There are other things you can do and use. There's plenty of products out on the market, especially um, when we get to, moisturizing the area, there's plenty of products that you can use to do that. For me, for the hot flashes, I can remember, I retired 3 years ago, and I can remember about 4 years ago being in a meeting. I was a tax accountant, and I was doing, somebody's tax return, and all of a sudden, I don't know if anybody's ever experienced this with a hot flash, and all of a sudden, I felt in the pit of my stomach. I just felt like an inferno was just starting, and my face lit up, and I was so red, and I remember the client asking me if I was okay because I broke out in a sweat. And, it is embarrassing when that happens. And, I didn't want to say, oh, well, I'm in menopause, but, you have to kind of figure out what to do. So, some of the things I've done for hot flashes, especially at night, because I still get those, or sometimes during the day I get them. And, I've just learned to dress differently, especially in the evening when I go to bed. Usually I'm covered up, and then by an hour later, I'm stripping, all the covers off. So, like, I've learned to dress very lightly. I've also learned to, um, for me, alcohol, if I drink any wine or have a drink before I go to bed, that definitely helps set off my hot flashes. As far as the fatigue, this has been something that has really been big on my list because I live a very active lifestyle. And so fatigue, especially when you have PV, some of your medications make you feel tired, and then, like, I go to the gym and then I come home and I'm very, very tired. And I didn't, at first I wasn't giving myself grace. And now every once in a while, I'll just kick up my feet and just, um, take a nap. And one of the other things I wanted to say about the fatigue issue is a couple of years ago is when I had my, I don't know what you call it, like I hit a brick wall. 3 years ago, I was in the gym and I wound up, um, doing step ups on the box, and I kinda slipped on the box and fell and broke my wrist, and I kinda smashed my face a little bit, because I fell forward. And I just remember after that thinking, like, "I can't go on." I just can't go on, keep pushing myself through this because, I kept trying to get through the fatigue issues, and I kept figuring like, "Oh, yeah, I just have to work out really hard," or whatever. So, I have kinda notched down what I do in the gym, and then I'm doing more things like yoga, Pilates, or just even sometimes 2 or 3 nights a week, I just go out for a quick little walk, and that seems to really, really help me with my fatigue. And, I wanna also talk about insomnia because that has been a big one with me. Most nights, I do have some insomnia issues. I have been tested, and I don't have sleep apnea. So, there's not much you can do. Like, one of the things I have done recently has been to start taking some type of magnesium. And again, like, I'm not a doctor, I'm not a healthcare provider, so you may want to talk to your doctor about it. That has helped. And I also take medication to sleep because I've noticed with me personally, if I don't sleep well, I feel like my symptoms of my PV like are much more exaggerated, and then I'm tired, and then the next day, I have the cognitive issues because I'm tired and I can't think, because of the fatigue factor. So I really, really think it's really important to, if you are having some problems with sleep. And again, these are overlapping symptoms. Sometimes I sit down and I'm like, well, is my insomnia because of my PV, or is it my insomnia because of menopause? And again, like, I really didn't have those problems when I was younger. But as I alluded to before, I really, really feel that I've had either ET or PV for a very long time, just in certain things. Um, and I really, really feel that you have to have a good relationship with your doctor. I had mentioned earlier itchy skin. Um, there have been times, and it still happens every once in a while, where I literally get out of the shower and I just want to scream because my skin itches so bad. And when I was in high school and college, I used to like practically cry when I got out of the shower sometimes because my skin itched so bad. And my solution way back then was to just go run and jump in the bathtub and use, I think it was a Vino, they had a product that was like an oil, and that kinda helped a little bit. And, I don't wanna be taking an antihistamine because of, the itchy skin, because then, antihistamines can cause other issues. So what has really worked for me is I use a couple of different products. One of the things I do when I get out of the shower is I definitely like, I don't do a very, very hot shower, and I don't do a very long shower. And when I get out, I let myself be wet, and then I put on like a moisturizer and like some coconut oil, and that seems to really, really help. And from there, um, I really feel that I kind of have the itchy skin under control. And when you're in menopause, you just don't realize how much your hormones play an effect on like practically every part of your everyday living and your body system. So I really think it's really, really important. Again, I think I've said it a couple of times to discuss, a lot of this with your doctor, and you have to have, an open relationship. And, changes in hormone levels during menopause can kind of influence some of your PV symptoms or your treatment. So, um, again, I think you really need to talk to your doctor about some of the things that, I discussed, like the night sweats and the irritability and the fatigue. And I can tell you, after dealing with cancer for 23 years, sometimes we all want an instant fix. And, you can't have an instant fix. And sometimes it takes a lot of trial and error and patience on your part. But, there's always something that you can try or do. And again, I'm very grateful that I found the MPN Foundation and Research Foundation and Anne, because some of the seminars are just so great and they really, really are helpful. And again, going through menopause is not easy. I retired 3 years ago, and that's been helpful. But even when I was working, my menopausal symptoms still affected me. I can remember sometimes, especially being a tax accountant, like I would meet with clients and I'd be mid-sentence and I'd be like, "Oh, okay, what did they just say?" or whatever. Again, because some of the cognitive issues that you deal with, that is like a duality between, was it PV, was it my medication, or was it, being menopause? So anyway, I hope sometimes you just have to give yourself grace also. I will say, after dealing with cancer for 23 years, I used to really resist. If I was tired or whatever, it was just like gut through it, gut through it, gut through it. And now I really have given myself grace. And on a day that I'm not feeling so great, then I do something different. I don't push myself anymore like I used to. And I really, really feel that that helps a lot. And again, like some of the things that I do alleviate my symptoms. One of the biggest things that I did, and that I think has been a very big change for me over the last couple of years, is I am on hydroxyuroxy, and I haven't had to have a phlebotomy in a year and a half. And I think that's due to a couple of things. I think we finally have my medication worked out to a very good point. And I also started to hydrate more. I didn't realize that I was not drinking enough water. And I can tell on the days that I don't hydrate, and it doesn't just have to be water. You can add like electrolytes to your water, or sometimes I add like a little bit of grapefruit juice, or not grapefruit juice, grape juice to my water, just so I get hydrated. I don't drink coffee, but I do drink tea. But I don't drink. I don't have any caffeine after um, 11 o'clock, because for me personally, that affects me when I sleep at night. And again, if if you're already in menopause or you have PV, you might have some insomnia issues. Some people that I've talked to who've had this disease don't have any symptoms, and it's amazing that they don't. But like I said, I have just learned over the years how to deal with things. And again, it's been a lot of trial and error. So thank you, Anne, for letting me talk on this subject. As I said, for me, it's been a really long road. And the one thing I can say, I kind of go by a little statement that I always say, is like, even if you stumble, you're still moving forward. And so sometimes in this MPN world, you will stumble, but you have to just learn how to move forward.
Thank you so much, Patty. I'm so appreciative to you for doing this and sharing your story. And I have to say, you brought up some really good points. And for those women listening and that will be listening to this recording, Dr. Michelle Corey, who was a PV patient and it became MF, who had a stem cell transplant. She is an OB, she was an OBGYN. Now she's just a gynecologist. And she has presented at some of our events and she has given some really good advice. And you kind of gave some similar advice that she has given to women who have an MPN and are going through menopause. So I can't thank you enough. And we will see you soon, I hope. Thank you. And now we're going to move on to Julia. And Julia is joining us and she is going to share her story. And thank you again, Julia, for being with us.
You're welcome. You're welcome. Yeah. And thank you, Patty. You touched on so many topics that I can relate to. And I'm so sorry you've spent 23 years dealing with cancer. Um, I guess my story has some overlap and some similarities, and I have some similar thoughts about definitely collaborating with your physician. But I'll start with who I am. So my name is Julia. I'm about to turn 63. And I was diagnosed with first ET in about 2007. And then the following year, it was determined that I had myelofibrosis. At present, I have PV/myelofibrosis. So I've made the rounds. I was 44 when I was diagnosed with ET. And similar to what Patty had shared, I think I probably had, and also based on the science of how long these diseases take to occur, I think I probably had ET for years. And I had had a child in 1998. And I was diagnosed in 2007. And even at that point, my platelets were rising and I had some complications of pregnancy that years later, and to this day, I still question if there were any connections. I was introduced to hematology oncology while being hospitalized for a reaction to penicillin when I was 32 weeks pregnant. And they found that I had a very high white count and abnormally shaped cells. And they were suggesting doing a bone marrow biopsy. And as I've worked in healthcare for many years, and knew what a bone marrow biopsy was, I talked them out of it and asked to be monitored, which is what happened. But officially, I wasn't diagnosed with an MPN until several years later. So I will never know if there's a connection. But as Anne pointed out, attending the Women in MPN conferences that MPN Advocacy hosts, which I suggest everyone attend if they can and certainly listen to. I learned a lot from Dr. Corey and several of the other speakers about issues that may be unique to women that I didn't know at the time. Um, uh, and when I was diagnosed with ET, I initially was not aware that I was symptomatic, but over time, I started to develop symptoms. And one of them that I had for years prior were migraines. And I think that's something that may have been related to hormone levels and changing hormone levels as I went from perimenopause to menopause. At this point, I still get them, and I question whether they're related to my platelet count. So I would say for me over the years, going from perimenopause to menopause, which happened around age 50, uh, there were a range of symptoms that my MPN specialist and I really weren't sure what was driving what. Was it my MPN? Was it menopause? And I'm not sure we had the answers at the time, but there was an absolute give and take and a trial and error of different, taking different steps to alleviate the migraines. I experienced night sweats as well. I still get them a little bit. And like Patty, I try to dress in layers, lighter layers. I live in a colder climate, so I start my night with like woolen socks, and about an hour into sleep, I am stripping layers off. And that's just the way it is. I think once you move into your older years and move into the years into your 60s and above, it is really hard to figure out what's driving what. Those issues of insomnia, I experienced that as well. Frustratingly, I still drink a glass of wine and then break out in a hot sweat and find that embarrassing in a social situation. Um, and just going back to the working with my clinician, I'm sorry, I'm looking at my notes to make sure I cover all sorts of things. Um, I think treatment certainly exacerbated it both helped and exacerbated some of the symptoms that I was experiencing. So over the years, I was diagnosed early enough that JAK2 inhibitors hadn't yet been approved. So by the time I went on a JAK inhibitor, which I was on for 5 years, it definitely helped with a lot of the body symptoms that I was experiencing from myelofibrosis. But I have continued to have very itchy and painful skin. And I do take an antihistamine daily, but it still doesn't resolve all of them. Um, Over the years, the JAK inhibitor that I was on caused additional vaginal symptoms. And so in combination with experiencing menopause. So these are not fun diagnoses to deal with vaginal atrophy and vaginal dryness. I was on a drug that for the myelofibrosis that also caused squamous cell carcinomas in situ. So they thankfully were superficial, but I ended up being referred to a GYN oncologist and seeing him over the course of about 5 years. I was diagnosed with several squamous cell carcinomas that had to be removed. So you can imagine that's not a very fun outcome. Having biopsies of the vagina on a fairly regular basis is a real challenge, I'll just say. Um, like Patty had pointed out, and I learned from Dr. Corey, there are a lot of topical solutions and lubricants that can be utilized. And I would say, in my experience, they help a little bit, but really nothing replaces youth and youthful hormone levels. Unfortunately, I have over the last, I'd say, 5 or 6 years experimented with the assistance of the GYN oncologist, and now I see a regular GYN, have tried different hormone replacement therapies, mostly targeted or vaginal or topical, so they are not don't have the same impact as a systemic hormone therapy. And they've helped a little bit. I'm currently trying a vaginal suppository, and it's improved the status of the tissues, if you will. But again, it's not like one's youth, in truth. I joke around that I met my husband, thankfully, before menopause. Hopefully that's not TMI for this group. What else did I wanted to share with you? I'd say at this point, I am, well past the initial stages of menopause. So I am living with some of the challenges of, of aging and menopause, as Patty mentioned as well. Insomnia can be a real challenge. I find I fall asleep easily, but I wake up and I'm more wakeful. So I often get up earlier than I wish, earlier than I want to. And then at other times, the fatigue of myelofibrosis means that I'm kind of dragging. So I allow, Patty used the word grace, but I allow myself, and I'm fortunate that I can, allow myself a lot of time and really try to schedule anything important later in the morning so that I've had time to caffeinate. To me, caffeine's part of my toolkit, my medicine toolkit. Um, and while I don't have the energy for, I would say, real exercise, I do walk every day and as many days as I can. And at the times that I was feeling sicker, I'm very fortunate right now to have, knock wood, so far, indolent disease. I still feel fatigue. There is always an underlying level of fatigue that exists for me. Um, I think those were the topics that I wanted to talk about. And I don't know if you're there, if you have questions for me.
I am there, and
Yeah.
we're not, this is not a Q and A, but I do, both of you highlighted some things or said some things that resonated with me. And one of the things you brought up is the fact that you met your husband before all of this. But I think it's very important to point out that, and Patty, I know you're married too and have been married for a long time, the impact that a diagnosis has on the relationship, the marital or partner relationship. And I know I have not met Patty's husband. I met your husband, Julia, and I know quite a bit about your marriage and your,
Yeah.
how wonderful he is. And I'm sure, Patty, that your husband is wonderful as well. You know, I lived with a father who had a chronic illness, and there were times of lots of tension, lots of uncertainties, and it was difficult. It was very difficult. And so perhaps, Julie, I could start with you, and just if you would like to share some of the things that have helped you and Tim to,
I think that's another, yeah, that's definitely another theme, living with a chronic illness, living with
right.
one. So Anne knows my story and knows that in the earlier years, I had a TIA, so I had a mini stroke. An ASXL1 mutation was identified, which so far has not, demonstrated progression in my case so far. But living even with the fatigue and the aches and pains definitely has an effect on your relationship and how much you're able to do day to day. And so I think that can cause definitely relationship strain. My husband is an incredibly understanding and attentive person and a pleaser. So we almost fight over who cooks and cleans the dishes at dinner. Not fight, but I feel like if I'm up to doing something, I want to do it. And I think, communicating about your challenges without allowing the disease to become your identity. And I also am a peer volunteer for Leukemia Lymphoma Society and often talk to people who are newly diagnosed. And I think I have been living with this illness for so long that I probably take for granted some of the things that I've learned. But I think it's a careful balance to live with an illness that is not going away, that ebbs and flows, that gets better or gets worse, and not allow it to take over your sense of who you are, and also not allow it to overly influence your relationship. So I guess my advice is just is good communication, and I think. I I was motivated to try a different vaginal suppository actually because I want to be able to sustain a romantic relationship. And yeah, it's just really important to having an intimate long-term relationship. Yeah.
Yeah, the emotional and physical intimacy, I think none of us want to lose. And especially in your situations, Patty, can you offer some insight, and then we will
Yeah.
say our goodbyes?
Yeah, I mean, so like I just kind of like Julia, like that is sometimes that can be a very touchy subject. And my husband is very, very understanding, and we'll be married almost 43 years in October. And we we knew each other before that, so almost 45 years. So we, we had a decent relationship, I mean, throughout the years. I mean, between my I had 7 pregnancies, had 5 miscarriages, so in between those, and then, the breast cancer, sometimes I won't lie, it would get pretty tense because, especially, in your 40s and, and 50, and you really can't talk to your friends about it because nobody understands. And then, like, so now, like, I'm pretty much like at the end of the day, I used to be a night owl, now I'm not. And so sometimes I'll have to say, hey, like, I'm going to bed now, or, like, and whatever, or because like the minute I hit the pillow, I'm out, but I might wake up in the middle of the night and, and then he comes along and it's like, oh, you're asleep already. And I'm like, yeah, hello. And, you have to kind of explain like, hey, I don't have any hormones. So, there's only so much I can do. And I didn't say in my other stuff, I did do the Mona Lisa, which it supposedly helps rejuvenate the vaginal area, but I'm not too sure if I would go through that again because
Never heard of it.
yeah, so what it does is, you go and you have to usually see a urologist, and they use like, it's like a wand, and then they go in and, it's like a laser, and they laser, and you have to get a couple of treatments, and then, I mean, it's not, um, I would not say it's totally pain free. It's a little bit touchy because again, you're using a laser, but you do have to kind of go back. And I think it did help for a little bit, but then like you got to keep going back. And I honestly think I might have had a little more damage doing that. But
Mhm.
I really feel it's really important to communicate that, and again, just like Julia said, I'm going to be 67 on Saturday, and I still crave the romance and all of that, so sometimes you just have to kind of find other things, that you have in common and do those
Yeah.
together, and, just be really, really open. And again, sometimes it can be pretty tense because, men have different bodies than women. And, so,
And older men have different bodies than women.
yeah, yeah.
Yeah,
And
and, the one thought that is permeating this conversation is we as women, and I'm not an MPN patient, but I am way past menopause and had similar symptoms. But again, you too suffer from different challenges. You never lose that. You never, I mean, I've talked to women in their 80s and 90s, and they've said, we still want that intimacy, and many still say, that physical intimacy is important, but it's got to be in combination with the emotional and the trust and the confidence in that person and the relationship.
yeah, and unfortunately I mean, men have Viagra. There is nothing for women. So, I mean,
Uh,
I mean, that's part of it. And like as Julia said, you're never going to go back to the youthful hormones that you have,
no,
especially through
no,
menopause. So,
no.
again, I think you just have to, set realistic expectations of where you're at. And,
Yeah.
and and again, it can be troubling. And then and cannot be troubling. So, because
I
sometimes,
think I'm sorry. Go
yeah,
ahead.
no, I mean, I think sometimes, you sit back and go like, why did this happen to me? And like, why, what? And then you really you can talk to people in your similar age group, and then you're like, well, is this normal aging, or is this, what is this? So, um,
That therein lies the question,
right.
because we have been hearing all these years, and Julia, you can attest to this, that, oh, these are your MPN symptoms. And I would sit in the audience and say, I have those symptoms. But also, I did want to touch on one other thing before we do have to leave. And that is, you mentioned migraines, Julia. We did a migraine survey,
For that.
and yeah, and it was pretty evident that I think it was 98% of the respondents were women. And I do remember having migraines myself when I was in my 20s. And it was due to the birth control pill that I was on at that time. And so, but there are some very specific things that are happening with MPN female patients because the numbers were just too high to be a casual thing or something that we shouldn't look at. And how did you control your migraines, Julia?
I can't say that this is the case, but I feel like once my platelet count was under control, so my very high platelet count was lowered, I feel like that eliminated almost all of my migraines. Um, I still get them, and actually working with taking any kind of additional hormone, even through the vaginal suppository, when I initially tried the sample the GYN gave me, he gave me a higher dose and I woke up with a migraine after taking it the first time. So I have to be really careful about they lowered the dose. I can't have a second or third cup of coffee because that'll trigger it. My platelet count is actually rising very steadily, so I'm not sure what will be next to control it, but and I'm not sure at what point that what level of elevation caused it, but I think when my platelet count is really high, that's when I think the migraines reappear.
Yeah, yeah.
And I will say
I have to-
I've had headaches here and there, and I noticed if my platelets or my hematocrit or hemoglobin are up, then I do get the headaches as
Okay.
well. And then I just take Tylenol. And it's funny that you said that because I did forget. I think after one of my kids, like I had terrible migraines to the point that I was really dizzy. So that's why I said I think I've had this disease for a very
I
long
think you
time.
have to. I think you have too, Patty. I really do. But listen, ladies, we do have to part for the moment. We will come back and have further discussions over the course of the year. And I thank you both very, very much. I've gotten to know you both pretty well, and I so appreciate you. And we will hopefully have helped some women today and those that watch later. And thank you again very much.
Thank you.
Thanks, Anne. Nice to meet you, Patty.
Nice to meet you.
Bye, everybody.
Bye.
Bye.